Hi, my name is Victoria Bangoshe. This presentation was prepared for HAP 671 course in Health Informatics program at George Mason University. According to CDC, 37.3 million people have diabetes in America, 11.3% of the US population. The population of diagnosed with diabetes are 28.7 million, which include 28.5 million adults. The population of those undiagnosed with diabetes are 8.5 million people. Possible complications of diabetes include kidney damage, Alzheimer's diseases, nerve damage, cardiovascular diseases. Data used in this presentation is simulated data from a major healthcare institution in America. The total number of patients and unique records are listed on this slide. To define diabetes, critical classification software was used to group ICD-9 diagnosis code as shown on the slide. This indicates diabetes mellitus with complications and diabetes mellitus without complications. The comprehensive set of diagnoses were used to predict the presence of diabetes or the risk factor for diabetes. From the data, there were 5,270 diagnoses that were observed more than 29 times with no gender bias. The following output shows the top 10 obvious predictors associated with diabetes. The first 5 are highlighted in yellow, which are as follows. ICD-9 high 401.9, which is the unspecified hypertension. I2 72.4, which is the pulmonary hypertension. ICD-high 305.1, the nicotine dependence. I530.81, esophageal reflux, and I414.01, which is the coronary atherosclerosis. This slide shows the first 5 rare predictors associated with diabetes mellitus. These are diagnoses that occur more than 29 times but less than other diagnoses. The first rare occurrences codes are I362.07, I998.33, I874.4, I300.13, and I694. Based on findings of the predictive models, here is a list of the top 10 predictors of diabetes. The top 4 include unspecified hypertension, pulmonary hypertension, nicotine dependence, esophageal reflux. To predict the odds of probability that patients have diabetes, we use the naive Bayes formula. The Bayes formula is used to calculate the probability of an event based on its association with another event. In the code, the likelihood ratio was calculated, which was then used to calculate the odds and probability of the predictions. To identify specific 5 cases, I used 5 ICD-9 code, which are as follows. I884.1, I039.0, IV12.2, IV40.3, and IV17.3. To find the overall probability, I used the product of the 5 likelihood ratio, which gave me a result of 7.0813. In order to cross-validate the dataset, I set aside randomly 20% of data into a temporary validation table and 80% was used in a temporary training table. The validation was used to create the receiver operating curve to evaluate the accuracy of our predictive model. In summary, diabetes is a serious health issue in America. If left untreated or unidentified, patients are at risk of developing other serious chronic diseases. Therefore, screening for diabetes can save lives. Thank you so much for watching my presentation and have a good one.